Good afternoon, everyone, and welcome. The Broadband Bunch Zero Touch Learning Series is live. Thanks so much for joining us. I'm Craig Corbin. Today's session, Life Post COVID-19, A New Normal, is the third in our series, with our first two having covered distance learning and telehealth. Be sure to join us for our upcoming sessions beginning 1 week from today, June 17th at 1 p.m., when we explore funding new networks in the era of social distancing. And then on July 7th, yes, fiber networks are still being built. And on July 21st, integrations in telecom. What drives success? The Broadband Bunch podcasts and Zero Touch Learning series brought to you, as always, by ETI Software, a proud member of the Fiber Broadband Association. Be sure to follow the Broadband Bunch on Facebook at www.facebook.com/the Broadband Bunch. A couple of quick reminders before we introduce our esteemed panel today. The session is most definitely interactive, and we encourage you to submit questions via the chat function throughout the event. Our team will be monitoring those throughout today's session. Session is being recorded and will be available to all attendees for future access. Also, please feel free to submit any potential topics for future Zero Touch Learning series sessions, or if you want to suggest prospective panelists to take part. And again, you can do that via the chat function throughout the event today. Thanks so much for your participation. Our moderator today is a true telecom innovator and thought leader with more than 2 decades of experience with AT&T. During his tenure there, he led a number of transformative endeavors, including major systems integration and modernization in both the BSS and OSS space. In addition, he led architecture and delivery teams in the digital domain space for business to consumer and business to business channels. Our moderator also is the founder and principal of BevTech, the well-known consulting firm focused on digital transformation for software and services companies. It is my pleasure to introduce you, our moderator, Guy Bavente. Guy, welcome.
Thank you, Craig, and welcome everybody. It is my pleasure to moderate today's discussion. So let me start by introducing our distinguished panel. With me today, I'll start with Mark Guerra. Mark is a financial consultant and estate planner. Mark runs a very successful financial planning and estate planning company. Mark is very passionate about helping families with things like tax planning, retirement planning, and money management in general, with a focus on middle management or middle income families. He's also a trainer in the field of estate planning. So thanks for joining us today, Mark. Also with us is Julie White. Julie is the executive administrator for Department of Medicine at the University of Chicago. In this role, Julie oversees all financial, administrative, and IT operations in medicine, which includes such things as research, patient care, and teaching. Prior to joining the University of Chicago, Julie served in a variety of similar roles in the Department of Medicine and Surgery at Stanford University. Welcome, Julie. And also with us is Dr. Chandra Saccharine. Chandra is a professor and chairman of the Computer Science Department at Loyola University, Chicago. Chandra joined Loyola University in 1993 after serving as a professor in computer science at the University of Central Florida. In addition to his teaching, Chandra also consults to local industry, government, and also helping such institutions like the U.S. Army in advanced computing subjects. So welcome, Chandra, as well. Thank you in advance to our panel, to what will be a very interesting discussion. Before I do get started, though, I do want to state that the opinions that will be expressed by Mark, Chandra, and Julie today are solely their opinions and do not represent and should not be interpreted as opinions or points of view of their employers or any associations that they may be affiliated with. Okay? With that, let me kick us off with an opening statement. And I really think we would all agree that with COVID-19, it has been a trying time for all of us on both a personal basis and a professional basis. So I think as a starting point, it is appropriate to just send out a message to everybody that our hearts and thoughts are with everyone who was impacted by the virus from a health issue perspective. And of course, deepest condolences to anybody who may have lost a loved one as a result of the coronavirus. Clearly, nothing is more important than the health and well-being of our community. As I think about some of the discussions since the pandemic started, there's one word that continued to always come up: unprecedented, right? Unprecedented. And this was used to describe the pandemic in many ways, whether you were talking about the hit to the economy, right? Or actions taken by the federal government for financial relief, local government response, the federal money policy itself, and so on. We have also seen, it's important to state, the goodness in people, right? The goodness in people coming together to help each other out and really be there for each other as we continue to, even though hopefully at the tail end of the virus, as we continue to go through the pandemic. As I heard someone say not too long ago, although the world, right, has been here before, let's face it, for many of us, this is a new experience, right? It's new, it's unsettling. I think it's also fair to say possibly frightening. So during such times, I think it's normal and reasonable to look for some certainty, right? But the only thing that is certain is that life post-COVID-19 will not be the same as life pre-COVID-19, which is the essence of our discussion today. So we're going to hear some thoughts on the impact of COVID-19 on the way we work, live, and play, right? We're going to highlight a few challenges that the panel here will share with us, and also talk about whether or not these will have longer lasting impacts and change the way we behave. So with that, I'd like to get into it and start with a conversation on virtual work, or some people talk about it in terms of work from home. In my experience, corporations and entities, for-profit and non-for-profit, started really looking at flex work arrangements that included work from home probably over a decade ago. However, in more recent years, the conversation changed on full-time work from home. Specifically, studies suggested that in-person live interaction, right, back to the office, was a more effective method for collaborating and driving innovation. So Julie, let's start here with you. Do you think that we will see a return to an increased interest in work from home as a result of the thrust to do so from COVID-19?
I absolutely do. I mean, this is a very interesting experiment that the nation is experiencing right now, with much of the workforce working from home. And there's a real success story, because we have been able to carry forward and advance operations while dramatically shifting where and how people work. I think at a personal level, I think that people have probably appreciated the flexibility. For many people who experience a long commute into the office, it's a relief to not have that commute. And for businesses that are crunched for space, in terms of office space and the ability to accommodate staff, I mean, I think it opens a lot of new opportunities to have people remote and not, requiring an on-campus footprint. But I also think it's the conditions that everyone has been working in are not normal either. It's not a normal work from home environment. I mean, many of us with young children have children at home. They're not in school right now, you know, and the inability to interact with the outside world on a regular basis, you know, in terms of going outside and experiencing restaurants and going shopping. I mean, our lives have shifted in many ways other than this, you know, work from home dynamic. So it's an interesting experiment. I think there will be an increased interest because of the flexibility that it provides, but I also think that many people are eager to return to the office.
I'd agree. Julie, I love, you know, referring to it as an experiment, because although some have tried it, I think in many ways it was an experiment. What about for you personally? Did you work from home before this COVID-19 pandemic?
So in my current role, I don't. I mean, occasionally, you know, if I have an appointment near my home, I might work from home that day, but it's been only a handful of times in 3 years. In my prior role at Stanford, though, I did work from home once a week, and that was actually quite nice. And in the Bay Area, it's, as you know, very, very common to have flexible work arrangements. So, so I do enjoy it occasionally. I enjoy, you know, not commuting into the office. And there are, you know, some benefits to that flexibility that I appreciate personally. You know, our university has had to really adapt. So, you know, many of the services that we provide are really essential. And so the clinical care that is essential largely had to continue in person during this period of time. And many of the essential research operations, especially the research that's focused on COVID-19, you know, those staff actually did continue coming into the office. But, you know, we were able to shift focus and shift efforts and enable many of our to, you know, to work from home and focus on other priorities during this period that didn't require them to be on campus.
Great, great. Thank you, Julie. Let's shift to education for a minute, right? Schools at all levels, from primary to university level, quickly had to move classes online, okay? So the discussion on distance learning, right, really accelerated, and really related to some of Julie's points. It touched many families, right? Not just from a job, but, you know, from children being at home. Now, Chandra, I know that at Loyola University, Chicago, you all had to make some significant changes across the university and definitely in your computer science department. Can you share a little bit about your experience and your department's experience with this?
Absolutely. Thank you. First of all, good afternoon, everyone. I would also like to wish everyone safety and good health going forward. Talking about a specific question raised by Guy, education at Loyola is a happy mix of traditional face-to-face instruction for the most part, and an online programming at the master's level. Business continuity plans are discussed generally, but the last time there was a discussion like this, it was, you know, the time of Asian bird flu. I don't know if you remember, was a scare that never really materialized. But this time it was quite swift. The campus was shut down in a week's worth of preparation. Obviously, there were a lot of challenges with regard to serving our students and equipping our faculty to succeed in instructional delivery. Here are some of the challenges. First of all, students had just 1 week to move out of the dorm and get ready to receive instruction online. Laboratory classes, you can imagine, are not easy classes to do online, especially biology and chem. So there were some innovative things that went on in doing those. Loyola's course management system uses Zoom and Panopto for recording and archiving video lectures. There were security flaws of Zoom that caused some issues for sure for both faculty and students. I don't know, I'm sure you've heard of Zoom bombing that happened in some instances. I found out that in addition, some of my students went back home to countries where we were mutually at totally incompatible time zones. One of them in particular actually went to Mongolia, and he was quarantined for 2 weeks, not to mention that he had to wake up at 2 a.m. or 3 a.m. to be in sync with my class. So it was unfortunate. but I had to make accommodations on the fly. I'm sure there were other situations with other faculty, similarly challenging. Faculty had to care about students who were displaced from their homes. Some of them lost their jobs, and some of them had to go back home to care for their dear and near. So there were a lot of challenges they went through. In addition, faculty members had their own challenges because they had to be rigorous as they would normally be in grading, quizzes, and et cetera. But at the same time, there was a clear recognition that these are exceptional times and accommodations needed to be made. So what really helped us in a big time was that we only had to do this for half the semester because the pandemic struck mid-semester. So overall, we concluded the term successfully. We try to make it do as well as we can, make things look as normal can be in these times. The real hard problem wasn't even all the things that went through, but what we are currently planning for the next semester. So I hope this gives you some ideas, some of the challenges we went through.
Absolutely. And thinking about those challenges, are you gathering some lessons learned in case we need to, utilize them to come back and implement some of the changes and be even more effective?
I think so. I think there is, learning at various levels. There was learning at faculty level. There was learning at the administrative levels, and especially using the platform in the right way. Some of the faculty members were not trained to do online teaching. Were trained to deliver instruction quickly. Now they're going through more training in the coming weeks and months. So this is going to be a continuing progression of things that we are trying to do.
Yep. I agree, Chandra. Thank you for that. Let's shift focus yet again and really take it to business at large. And it is amazing to me, similar to how the education community adjusted, right, or adapted or adopted some new tools. The business community had to do the same, and quite frankly, their customers and clients also were remarkable in the way they adjusted as a result of the pandemic. Mark, let's start with some of the adjustments from a business perspective that you had to make. Can you share a couple of business practices that you had to implement or some changes you needed to make as a result of the pandemic?
Sure. Yeah, I'd be glad to do that. It's interesting to know, and I've been involved in this industry now for going on my 39th year, and I've seen a lot of changes from back when we used to use what we call nowadays an illegal yellow pad, where you'd write everything out. Or now everything that you present and you produce is factual and to the point and compliance oriented and that sort of thing, and that's really driven our business to doing more digital types of meetings and collecting of information. And you mentioned earlier that this, unprecedented, and this whole situation that we find ourselves in from the COVID-19 is definitely unprecedented in our industry as well. But fortunately for us, it has just caused us to have to accelerate what we've already been on track for. And we're right now in a matter of about 90 days where we had anticipated being in another 24 months. And so this is a good thing. It took a lot of stepping back from a number of individuals to create an environment and ability to do various types of go-to-meetings and webinars and Zoom meetings, and to just keep our entire field force and representatives that work with us nationwide all in sync and able to communicate well, but also teaching individuals who usually make their presentations eyeball to eyeball, one-on-one, to where they can now use these Zoom meetings and FaceTime and just all the vehicles. And we thought initially that might be a challenge for our clients that are in their retirement age. And what we found out gladly is that it wasn't a challenge at all, because most of them are grandkids and they've been doing FaceTime for years, however many. So So we've really met with less difficulty in a transition that will change the way we do business. Even a lot of the documents that we have to sign in the past and have been required to have what we call wet signatures, institutions now are saying we will take a DocuSign document. So a lot of those things are changing that I'm sure it'll be 12 months from now before we really see how everything settles down. But as disappointing and unfortunate that we find ourselves in this situation, we have a very positive outlook towards where we're headed for our particular business. And I think I see in a lot of other businesses too that have embraced technology to do their work or do their service, a couple years ago. Maybe they didn't need to be there a couple years ago like we didn't, but today you find yourself, you got to do it. It's just like the universities. If you teach in a one-on-one class where you got students in class, and then now all of a sudden everything's got to go online, I'm sure there's professors that have no clue, as you were mentioning, Chandra, how do you even go about doing an online thing? Because all I do is stand up and teach, right? So those are challenges. I think we'll be able to receive more information quicker, and it'll help all of us as individuals grow and become a better you.
Right. Agree, Mark. What's really interesting, we talked about how you as a business adjusted some practices, but you also hit on how your clients adjusted, because I was thinking about a segment, a pretty good segment of your customers are those that are either about to enter retirement or already there, right? So I think it's fair to say maybe an older segment of the population as a customer base. And as you stated, many of them were already adopting or had adopted some of the tools, doing a Zoom session or FaceTime with grandchildren. So it seems like we may have even been a little more ready for this than we may have even thought as a population, right? Very good. Let's move to yet another topic and talk a little bit about telehealth and telemedicine, which has also been in the news. Virtual care, right? Being able to receive care from a provider online. I think it's fair to say that it accelerated as an alternative to traditional office visits as a result of the virus and to keep patients and staff safe. So Julie, you've been around the medical profession, as we've said, at both the University of Chicago and previously at Stanford. Share some points of view on telehealth and telemedicine, please.
Okay. So personally, I'm a huge advocate for telemedicine and telehealth. During my time at Stanford, the university was really ahead in launching platforms to encourage telemedicine. And while I was there, I was part of the group that launched the Center for Digital Health, which is broader than what you're referring to, because it's also talking about digital innovations and the incorporation of monitoring, research, clinical care. But Stanford was really ahead on telemedicine, and I think what has happened with some of these waivers is really the push that the nation needed to advance this more broadly. And there were definitely some growing pains, but I think that there is this eagerness on the patient side when you think about patients as consumers of medical services and the idea of convenience for a lot of, for many of the offerings of virtual care, to be able to talk to your doctor from your home, to not have to go into a hospital or into an outpatient clinic, especially when you're ill. I mean, when you're ill, many people don't want to leave their bed. And then the idea of having to go in to see someone to in a traditional way, really is hard for people. It's hard for many of those patient populations. And so I think it's been quite welcomed, and on the patient side. And then I think the providers have appreciated being able to continue their care, having that continuity of their care. you know, there definitely have been some growing pains as this has evolved. You know, I'm not a physician, but the feedback that I've received, you know, from our group is that the video visit really does add a lot more than the telephone encounter. So, you know, when this launched, you know, many of the physicians were doing phone calls with their patients, and then in parallel, they were trying to get platforms up and running to do video visits. And, you know, the telephone call was, it's limiting, you know, and so I think that the video capability really does add a significant enhancement to the experience for the patient and provider. But we're also finding it doesn't work for all populations, or at least the adoption is less in certain populations. So what you were referring to earlier about perhaps the older individuals who are not as comfortable with technology, I mean, we definitely have seen lower rates of adoption and usage in those populations. And then in certain specialties that don't lend themselves to just the video type visit. But overall, I think it's been a great push forward, you know, and this also is an experiment, right? I mean, we're living through this, and I think overall, though, it's been positive to be able to do this, and I'm very thankful that those waivers were put into place.
Yeah, I agree. You know, I was reading on how Medicare and Medicaid as a program needed to loosen some regulations. One that, you know, was I guess I'd say enforced, you touched on, Julie, was the requirement that to provide remote care, you really needed the video capability, right? Not just voice, be able to see the patient. But one of the other topics that was touched on really had to do with how the medical profession gets paid, right? Reimbursed for service. And, you know, there were some, I guess I'll call them restrictions and guidelines that were loosened. But it was interesting that in what I read, they called them temporary changes, right? And I thought that was interesting. And so the question to you is, do you think they will be temporary, or do you think, you know, doctors have gotten more used to it and patients like that flexibility to your point? Do you think this alternative is going to lead to a more permanent service alternative than, you know, a traditional office visit?
I certainly hope so, but we don't know, right? And so as I was describing it as an evolution, that's really what it is. I mean, week to week, we're seeing changes on reimbursement and policies, and I don't know what the future holds, but I do hope that this continues to be an option. I mean, if you think about settings where people receive care, right? So people go into a clinic setting, people go into a hospital, people go to urgent care, people go to the emergency room, right? What's really best for the individual and for the healthcare systems is for people to receive care at the appropriate site and facility with the appropriate providers, right? And what we're seeing is that, you know, for many of these encounters, a virtual visit is absolutely appropriate, and it's overall, it's a lower cost alternative, right? The limitation, though, is that if someone needs to have labs or x-rays or, you know, additional testing beyond that virtual visit, then at some point they do have to physically go somewhere in person. But I think from a payer perspective, you know, there's definitely benefit to people receiving care, you know, at sites or virtually that is the best fit for their need. So I certainly hope that it continues moving forward. I mean, you know, we see opportunities to perhaps expand geographic reach. So can you reach patients that are, you know, 100 or 200 miles away who wouldn't normally be inclined to see a specialist at the University of Chicago, but perhaps, you know, lifting that barrier for, you know, an initial consult or discussion, you know, encourages them to get the right care from, you know, from the right physician.
Yeah, great points. You know, in another session, one of the obvious, but maybe not talked about, is kind of the convenience of allowing family members, right, for those of us who are caring for elderly parents, right, to be able to join without having to take a day off work possibly. So there are a lot of benefits, and I agree with your overall point that this has really been a push to advance. How far it will go, time will tell, but it has been, I think, a good thrust in a very favorable direction. Let's go back to work practices for a minute and even bring in the technical platforms into the discussion. There's this concept of time shifting that's often talked about that basically is a belief that if you allow people to work when it's convenient for them on their own time, if you will, they set the schedule, there's a belief by some that you will be more productive. In fact, hand in hand with that, and really more of an outcome of the gig economy, right? There's a lot being discussed about the gig economy where you move from engagement to engagement. There's this concept of task orientation, which is similar. Task orientation says you get assigned a task, you know the date when, in simple terms, you know the date when it needs to be completed. And again, using time shifting, work when it's convenient for you. Now, this is a topic that didn't start to be talked about just now with the coronavirus, but I think, like the other topics we've discussed, the conversation will accelerate, and I would say even become a bit controversial. And why is that? Because this belief that one is more productive implementing task orientation and time shifting principles is not accepted by all, right? Those that are opposed, we'd say, or not sure yet, would actually say that in-person live interaction is more conducive to collaboration, teamwork, and sparking true innovation. Chandra, let's come to you. Give us your perspective on this. What are your thoughts on it?
Thank you, Guy. First of all, I would like to echo some of what Julie said regarding the shift. My wife is a practicing physician, and she went through pretty much a change in the scenario, how she would talk with her patients. And initially, she did not like to either do the video or the audio, but then she realized that patients needed that. So I could very well understand what Julie was talking about. Thank you for that. So coming back to Guy's question, that's a great question, Guy. So time shifting does increase productivity, and task orientation provides you with a timetable to get a task done. So how do you do this together in a team setting? So I'm, rather than giving you my abstract perspective, I would like to walk you through an actual collaborative process that I was part of that had actually an extra interesting twist. The twist was it had a pretty aggressive deadline. So this process was about the hiring of an academic executive within the university in 6 weeks of time, when normally this would take a full 6 months of time, if you can even believe that. The search committee was large, about 25 people, various constituencies, faculty, students, staff, administrators, etc. The committee basically, the chair split the work into various tasks. The committee split itself into multiple groups, each picking up a specific task. The chair of the committee sort of set the deadlines for each task. The groups did some time shifting in parallel and respecting the deadline to accomplish the goals. The groups initially met almost every other day initially to determine if there are friction points and went over things that need a resolution. The chair of the committee, I would say, that provided key resolution for any intergroup conflicts. So this was all done through virtual meetings and document sharing primarily. The whole process was a variation of what you would call an agile software development process, to use my lingo. The whole, it was worked really better than we had expected. The committee finished its work really efficiently, but the aggressive timetable had a little bit of hiccup when certain written documents did not go through proper vetting, and there was some hand wringing in the end. That was one of the very few issues that we encountered. So I believe time shifting and task orientation can be managed successfully through frequent and effective communication, but also decisive actions. I think human ingenuity cannot be underestimated. If we believe in something and put our minds to it, pretty much we'll find ways to improvise and get things done on time. Hope this gives you an idea. Thank you.
Yeah, perfect, Chandra. Thank you. I love your example or your experience, and also the Agile methodology. I think many in the software world know it's about building software in iterative, smaller cycles, right? With the intent to get to the end state faster, right? And learn if there's any changes that need to be made earlier on, so you don't get 18 months down the road and say, oh, this is not what we wanted. I love that, because I think there's another case, right, of an experiment, if you will. And any of us who have been involved in Agile development, we know that there's a textbook version of what Agile states, and then there are the adjustments that you make. And typically the adjustments are on the human side, right? How often do we communicate, right? How often should we come together and have what in Agile they call a stand-up, right? So great points. Let me take us yet to another related topic, and this has to do with some interesting comments that we've heard in the press by some very vocal business people, and the one I'm going to use, we can even call a celebrity now, right? Kevin O'Leary, Shark Tank celebrity. Okay, I'm not the only one that watches Shark Tank, am I? But Kevin O'Leary, who is a Shark Tank celebrity and an entrepreneur, in an interview stated that he's always been obvious about all the office space his businesses occupy, right? And really, his point was, I always wondered if it really was all necessary. And he suggested that COVID-19 and the work from home experience solidified, his words, right, solidified for him that there's something that could be improved in the cost structure. In fact, he went on so far to say that he thinks he could remove 20%, 20% of the fixed cost from his business. So Mark, let's go to you. You've started several businesses. I'd say you're an entrepreneur yourself, right? Do you think institutions, businesses, right, will revisit the cost structure as a result of this? And could it lead to some long-lasting impacts?
Absolutely. In fact, we already see it taking place in a number of relationships that we have. One that I personally have with an individual who's an astrophysicist and works for an engineering firm. As a consultant, I just communicated with him in the last couple of weeks, and he worked for a firm out in Boulder, Colorado that had 7 other engineers on the firm, office space. They went home, and he informed me last week that the owner is not renewing the lease because working home is working out so well. And that they're looking at doing some of these conference room, on the spot as you need them, rentals for their business. And there's another individual that is talking about doing the same thing that owns a business down in Nashville here. So it's interesting to see people already. They're like, hey, let's do this. We're going to do it. And I think we're going to see a lot of that taking place. That's just 2 people in my world. And it makes sense. I mean, obviously the retail end things, the food shops and, all the other things, our Starbucks hangout, those things are going to be there. But I think a lot of us that are providing service and knowledge and education, we're going to be able to do it in less time and more efficiently. And I think this business will see that, particularly small businesses.
Yeah, I agree. Okay, hey, it's time to change it up a little bit. We're going to change the momentum up and use a kind of Q&A process we like to call rapid fire. So I'm going to ask some relevant questions, but instead of spending a long time on each of them, which we could, right? We're going to look for some quick answers from each of you. Okay, we're going to go in order, in this order specifically. We're going to let Julie go first, then we'll go to Chandra, and then to Mark. And let's see if we can keep this straight. So you guys ready to go?
Yep.
You bet.
All right, here we go. All right, maybe this one's a little bit of a fun question, but we need the truth here, okay? Did you get dressed each day before you started remote work? Julie?
Yeah, yes, I did, but not as formally.
Okay, we'll let you go with that. Okay, Chandra?
Yeah, comfy sweatshirt and hoodie and pants.
Mark?
Every day, just like I was going to work.
All right. Okay,
Yep.
Next question. If you think about your favorite tool or maybe device that you use for virtual work, what would it be? Julie?
I think it's a love-hate relationship with Zoom.
Love it. Chandra?
A lot of Apple devices.
So you can't pick just one. Apple. You picked a company.
Apple. Yep.
Apple.
That's it.
Mark?
It has to be my Surface Pro. Gotta be with me everywhere I go. You know,
Okay.
I can make phone calls on it. We can do text message. You do anything with it with any device. Plus it's
Okay.
light.
Got it. Got it. Think about behaviors here. Have you changed any behaviors with remote work that you plan to make more permanent when we get back to something considered normal life? Julie?
Yeah, definitely more forced walks, so walking, biking, trying to do something to get out of the house. So hopefully I will take walks maybe at lunch at work.
Great. How about you, Chandra?
Yeah, for me, for the people that I most frequently communicate with, I'm using now lightweight chat type of media. It works really well.
Good, good. Mark?
Washing dishes and doing house cleaning. I just don't. I wasn't made for that.
Wait a minute, Mark. I wasn't going to do follow-ups, but are you saying that you started washing dishes and you're going to keep doing it?
Absolutely.
Okay, I'm going to take note of that.
It pays a great bonus.
Let's talk about social norms here for a minute. People have talked about that we're going to maybe change behaviors like handshaking or maybe spatial distance, right? Is social distancing going to become a new norm? What are your thoughts on that? Will we actually change some social norms, probably more permanently, as a result of this? Julie?
I think so, and it makes me a little sad to think about less handshaking and less hugging. One thing that I hope actually changes because of this is we've been doing more Zooms with friends and family that are remote, and we actually have more interactions than we did before.
Yep. Chandra?
Yeah, I do believe the next 12 months, the social norms will change, unfortunately. But beyond that, it would be selective based on familiarity with people.
Mark?
Mm-hmm. Yeah, I think Chandra hit it right on the head there. I think that we're gonna continue to shake hands and hug those that we're close with and are comfortable with, and we're gonna be cautious going forward. And we should be cautious, but not afraid.
Yep, yeah. I don't know if I'm the only one, but it's been interesting this last week as you see some friends that you haven't seen in a while, you kind of do that hesitant, are you hugging again or not? And then people just ask. Okay, one last one for this round of rapid fire. If you had to name just one thing, just one positive thing that you personally experienced that came out as a result of the pandemic and the lockdown, what would it be? Julie?
It's the family time.
Love that one. Chandra?
Absolutely. It's spending more time with family. We also have a new puppy, Milo. So.
Oh, we have a new cat. I'm sorry to go out of order, but we took a rescue cat, actually.
Okay.
Okay, and Mark?
Family time. It really allows you to value why you do the things you do and who you're doing them for. And it's been good. Been very good.
And Mark, would you like to disclose a pet that you acquired that you previously didn't? Fish or otherwise?
No pets.
Okay. Yeah, got it. Hey, thanks for having some fun with the rapid fire. Let's go to a topic that is a little bit closer to home for some of our audience here in telecom. Okay, it was reported even when the pandemic started that as many as 21 million people in the United States, 300,000 alone in New York City, that was in the news a lot, that many still don't have reliable high-speed internet access. And I will tell you, and many people that may be listening may have heard higher numbers, and I have too, as high as 100 million. I think the disparity in, is it 21 million or 100 million, usually has to do with defining what reliable and high-speed internet access is. Regardless of which number is high, even if it's 21 million, it's too many. In fact, Jessica Rosenworcel, who's the FCC commissioner, said that net neutrality limits the FCC's ability to force the hand of telecom providers. Okay, so the question really will go to you, Chandra, first. Do you think that as a result of this pandemic, we're going to see increased pressure coming from the regulators to push broadband internet connectivity deeper into the communities across the entire United States?
Yeah, I think it's a challenging question, actually. Let us just start with the numbers you quoted, Guy. The number of people not having reliable high-speed internet varies from about 18 million to about upwards of 100 million. So we do not know, we do not have reliable numbers. And even FCC's own report is at odds with what some of their commissioners think. FCC's report on the status of digital divide and broadband access is based on data provided by the carriers that some of the commissioners have questioned. So despite the fact that reliable data is hard to come by, there seems to be, I would say, prevailing opinion that broadband penetration needs to be a lot higher than where we have right now in the country. Congress wants the data gathering cleaned up by FCC because there have been various kinds of reports about what the penetration currently is. So there is definite pressure on the regulators. There's also pressure, by the way, on the legislators to close the digital divide. So there have been reports about too many Americans not being able to access online work, medical help during this pandemic, and furthermore, distance learning has been a problem for people to access because of high-speed connectivity is either expensive or inaccessible. Loyola, being custodians of leadership in education, we actually provided a nominal amount of money to our faculty and others who did not have broadband connectivity. So certainly the pandemic has shown that broadband is a must-have in times like this. It's not a luxury anymore. Certainly, to rebuild the economy on the other side of the pandemic, a growing support and pressure on all parties involved will likely result in some significant changes. But at the same time, the actual definition of what a high-speed connection is something of a moving target, even within FCC's internal discussions show. So with the arrival of 5G in a limited way currently, so there will be pressure to provide higher bandwidth access, no doubt. However, technology and affordability will again be difficult topics of conversation in the context of ever widening digital divide. But I'm hopeful there will be substantive discussion in that regard.
Yeah, good comments, Chandra. We could probably spend more time on this, but I want to push us forward to a couple of other important topics. Telehealth technology specifically. We addressed, the movement and the thrust or the push, as Julie called it. Julie, let's talk about the technology side. It has been an emerging space in the telehealth environment for some time. There are already some tools out there, Doxy, e-visits, single visits, so on and so forth. So they're already available in the marketplace that are used to manage the entire experience, from scheduling appointments to actually managing that virtual online checkup, follow-up, so on and so forth. my question really has to do with adoption of technology by physicians. Do you think, based on your experience being around physicians for some time, do you see wider adoption of technology in medical practices as a result of the pandemic experience?
Well, I certainly think on the visit side, and obviously the virtual care side, we've seen this very broad, rapid adoption. I think what we were seeing before that was integration of other types of technology into practices, right, to improve convenience for the patients, therefore, in some cases actually reducing the burden on staff. So a perfect example is allowing patients to schedule their own visits. It sounds like a very simple thing to do. We make reservations for a restaurant, right? So, shouldn't there be a similar technology for making an appointment with your doctor? But obviously it's a little more complicated than that. What types of visits and what types of providers should an individual patient be able to schedule on their own? What level of knowledge about the patient beforehand is required for that patient to actually do that on their own. So I think there's some complexity to it, but there's certainly an opportunity for many specialties, many types of providers. A simple integration of technology on scheduling can alleviate the burden on systems and actually, provide more access and greater convenience for the patients. I think that, and again, I'm not a physician, but I do get a lot of feedback from physicians on a daily basis. And I think it's very important to them to have that connection to their patients. And I think that if technology can be integrated in a way that enables them to feel, satisfied and feel like they are, delivering care in an effective manner and can maintain that relationship with their patients, then I think it's sustainable for a long period of time. But I think there is a gap there because, as I said before, there are specialties and many circumstances that don't lend themselves to remote care, and in-person really is still the standard. So I think there will be more and more enhancements, and I see this just continuing to flourish.
Yeah, very good point. It's going to be selective, I think, at least at the onset. Although an earlier point you made on choice, and like many technology adoption efforts we've seen in past years, consumers, I think, will expect it. And when it creates a competitive differentiator, I think it can accelerate across the board. Excellent points. Zoom came up earlier as a collaboration tool. And I will tell you, Zoom was definitely a recognized company. Chandra mentioned Loyola has had it as its primary tool for collaboration. I've been in companies where it's been used. I think it went from awareness to, I would almost dare say, a household recognized name, right? The stock price definitely reflects that.
Right.
So when you think about, periods like this sparking innovation for tools, Chandra, let's maybe just focus it on learning tools. Do you see further innovation related to learning tools that are going to be brought into the educational system, some that may exist or some maybe new ones?
Yeah, I would have to say that my knowledge on this topic would be confined to my discipline. So I would preface what I'm going to say with that. I would agree that Zoom, Teams, Skype have enjoyed much success due to the pandemic, no question about that. This has actually woken up some of the other tech giants to step up their game, like Google and Facebook. They are putting a lot of things out there. So there is and there will be competition, and competition is a good thing. Secondly, collaborative tools are being integrated more and more. For instance, GitHub right now has a classroom feature that can be integrated with another tool called Ripple IT, and Ripple IT provides integrated development environment for many programming languages. So then you have the content management system such as Sakai. So you put the Sakai and Ripple IT and GitHub all together and we have a beautiful system for collaborative code development that can actually be used live via Zoom and other means. So in addition to this, Zoom has now an API that allows partners to work on interesting things, newer products, to expand the scope and purpose of usage of Zoom. That's a great thing. So you're right on the money, Guy, that there will be not only more adoption, but also advanced learning tools that are going to come about in the entire spectrum of communication, teaching, and collaboration in ways that we're just beginning to imagine. Of course, as always, the overriding concerns will be security and privacy. I have to emphasize that. We'll definitely see new breakthroughs even in those criteria. This pandemic is crisis for some, but it'll be a boon for a lot of others who see the opportunities.
Yep, great comments. We have a few minutes left, and again, a reminder, questions could be posted in the chat and we'll take them from the audience. I want to sneak in a couple. This one, let's go to you, Mark. Not to put the financial advisor consultant on the spot, but without a doubt, the last week or so have actually shown some very positive movement in the stock market, right? But nevertheless, I think many would agree that there's still a lot of turbulence. And the turbulence, going back to some opening comments, can be quite scary. What are your thoughts on the stock market? Is it going to stay volatile for some time, or do you see things settling down?
Yes.
Okay, perfect. For the record, this was not the rapid fire.
Yeah, I'll tell you what. Here's the thing that people need to remember is that the pandemic, as it affects our overall financial markets, it needs to be looked at more like almost like a destructive hurricane that's taking out a certain area and going to require that area to go through development and rebuilding, and it's just kind of done that nationally with us. In every industry, but again, it's something that took place and can be repaired. And obviously there's loss of businesses, there's loss of opportunity, there's loss of different things with any kind of catastrophe, whether it be weather related or whether it be this situation. But I think that we'll return back to the cycles that we've run for the last 70 years, right? The market's going to move up and down, and fortunately we came into this situation with a very strong economy, and that really helps undergird. It's like having a really deep foundation under a house that's sustaining a hurricane.
Yeah. Let me sneak in. Thank you, Mark. Let me sneak in one more. And I want to go to something, Julie, that you talked about. The question is, if the schools don't reopen in the fall, any thoughts for the working parents out there on how they can start planning, should start planning?
So I got to tell you, this is hard on the parents. And, I'm speaking from a position where I have a very engaged husband who also has a full-time job that's very demanding. And I have kids who are pretty self-motivated, and they're actually, very capable, although they're only 7 and 10. So I think in many ways I have it so much better than other people that are in this same situation. It really is hard on the parents, but I think it's hard on the teachers too. To so abruptly change their delivery models. My kids didn't really know how to check emails or open attachments or use a computer for 100% of their work. And so they had to very quickly shift to that. They think a computer is for coding, which is what they do in school right now. They don't use it for business the way that we do. So it has been a very rapid adjustment. I think it is very, very challenging on the parents, on the kids, on the teachers. And, I think that for many people, it's very, very hard, especially if you have kids that need more help, or, if you're not in a position to have a partner, that is kind of sharing the effort with you.
Yeah, without a doubt. My daughter-in-law is a third grade teacher, and she shares all the comments that you've made from yet the teacher's perspective. But I think the one thing I would add, the partnership between the parents and the teachers usually is what makes a difference. Let me do this. Before I turn it over to Craig, I want to thank Julie, Chandra, Mark. I want to thank you guys for spending an hour with us and sharing your thoughts on this. With that, Craig, let me turn it back over to you for the close.
And thank you so much, Guy, and a huge thanks to our panel. A phenomenal conversation this afternoon. So many thoughts that I've gleaned from the responses that were so important. And I think, Julie, with you, the rapid adoption of telehealth. In fact, I had my first consult with telemedicine this last week, and so I'm on board with that. It works, and it's very convenient. Chandra, with your reference, among other things, to the ever-growing digital divide, that is a topic that, again, we can have multiple discussions on, but now is the time, it's a golden opportunity to take the ball and run with it and make sure that we do get accessibility for everyone, knowing that, you know, 1 of every 5 students across the country does not have accessibility is just inexcusable. And Mark, with your reference, among other things, to making sure that the foundation of your financial house is built to survive a hurricane, that is absolutely good advice. We want to thank everyone who has taken part here today and encourage those who have observed our session to make sure that you tune in to our future series, the Zero Touch Learning series. Again, the first one that appears on the calendar a week from today on the 17th, and we look forward to that. Guy, thank you so much. Wonderful job moderating. We look forward to our next one. On behalf of everyone with the Broadband Bunch, ETI Software, I'm Craig Corbin. Thanks so much for letting us be a part of your day. We'll see you next time.
Thank you.
Everyone.
Thank you all.